Welcome back to Let's Talk About Our Health and Well-Being with our amazing doctors, Dr. Choma and Dr. Osela. It's really been a while because of COVID issue, but we are happy to be back again with our show, Let's Talk About Our Health. So today's topic, we will be discussing on diabetes. However, before we jump into diabetes, we have to answer questions we got from our audience. And so some of the questions the audience sent to us in our previous show on high blood pressure. So we will look into them, and after that we kick off with diabetes. So Doc, welcome back. I'm so happy to be back again with you and our show. It's really amazing, and hope our audience are waiting to hear from us. So so in the previous discussion regarding to high blood pressure, so they sent some questions. One of those questions is what we discussed. They said that we didn't discuss much on low blood pressure, so we only discussed on high blood pressure. So someone asked, she wants to know what low blood pressure is and the range of low blood pressure. So Dr. Choma, can you let our audience know what low blood pressure is and the range?
Okay. Low blood pressure as a range will be anything systolic blood pressure, that is the top number when you measure your blood pressure. If that reading is less than 100 millimeters of mercury over 50 millimeters of mercury, so 100 over 50 will be considered as low blood pressure. Having said that, for some people that is normal. Their day-to-day blood pressure is about that range and they don't have any problem. So you wouldn't necessarily say that they are suffering from low blood pressure, hypotension. We only call it low blood pressure, hypotension, if that person is having symptoms at that blood pressure reading. Yeah. So unlike high blood pressure, whether you're having symptoms, often you don't, you have to treat it. But for low blood pressure, as long as the person isn't having any symptoms, you don't do anything about it. If you just encourage them to make sure you drink enough water, make sure you have a little bit of salt in your diet. But as long as the person isn't having any symptoms, it's nothing to be worried about. And what are the symptoms that one would get with low blood pressure? Generally speaking, you feel tired, you feel a bit lightheaded, a bit dizzy, and some people feel like you're unwell. You may start to feel hot and sweaty, and generally that would be your body responding to that low blood pressure because it's abnormal for your system. So your body, your heart rate will start to go up as an effect to increase your blood pressure.
So it does not cause that like high blood pressure, something, maybe someone slump and die instantly. Low blood pressure doesn't do like that.
That would be a critically low blood pressure. That would generally be different. Something, for example, you have an accident and you're losing blood because you're bleeding and your blood pressure start to drop. If you don't do anything about that, yes, that person will die, that person will suffer brain damage, that person will suffer organ damage because the blood pressure is very low to maintain life. But that is as a result of something. Yeah? So generally speaking, the low blood pressure you would see in the general population, it's not going to lead to something like the heart attack people will get. But you only, if the person is having symptoms, which we mentioned, the feeling unwell, feeling lightheaded, then you need to do something about that. But as long as the person is not feeling anything, then you don't do anything about it. It's not a disease in itself.
It's not a disease
It's sometimes there's a rare cause of low blood pressure as well. That is secondary to hormonal imbalance in the body. There's this little pea-sized gland that sits on top of the kidney. And when one of it, in particular the aldosterone, is not working well, it can present with low blood pressure. Alongside that would be the tiredness, because it's only when you run your test that you get the numbers. But the presentation, I know we're all dark skinned and under the sun we are dark skinned, but you kind of look darker than you were. The palms of the hands are actually just as dark, and tiredness. Significant tiredness, in particular trying to rise up. The muscles that help you can dip your arm to brush your hair and climb stairs and such like that, they tend to be affected. And the presentation obviously will be bad low blood pressure, the tiredness, difficulty kind of going up stairs and looking darker with the palm of the hand being dark as well. I mean, clearly, if those ones are happening, you really need to see a doctor because it's a chemical test that will confirm that for you.
But like high blood pressure is a bit hereditary. Low blood pressure, do we have case of family or in low blood pressure?
With the hormonal link, yes, it can be inherited. But ordinary low blood pressure, I wouldn't think. But I mean, I'm talking in particular about somebody presenting with Addison's or with lower aldosterone and stuff like that. It can run in families, and not only will it run in families, it may be associated with other hormonal problems as well. But the Addison's in particular is the discoloration or tanning, is what people will call it.
Wow, that's good to hear, honestly. And someone again asked, I always have low blood pressure when pregnant. What might be the cause?
Okay. Yeah, I mean that with pregnancy, the way the body works changes. We already touched on the certain hormones that would lead to low blood pressure. So similarly, in a pregnant woman, you have a lot of the pregnancy hormone changing the physiology to make sure that enough nutrients and blood flow to the placenta.
Okay.
So that in itself will mean that some of the circulating blood is redirected towards the placenta, leaving the lady's circulatory volume low. So that is one reason why a pregnant lady will experience low blood pressure.
Wow.
And that would be why you say when you're pregnant, avoid lying flat on your back.
Okay.
Avoid when you're sitting down, putting your legs up on a footstool, sort of encourages the blood flow back into the heart to maintain efficient pumping of the heart, and making sure that you drink plenty of fluid to increase the circulatory volume. So yes, because of the pregnancy hormone, there is a tendency to develop low blood pressure during pregnancy. But that condition quickly settles once the lady gives birth.
Wow, and it's something that will be corrected when the lady gives birth, right?
Yeah.
But which one is more risky? Is it high blood pressure or low blood pressure when one is pregnant?
Well, that's where you have to put it into context. For the high blood pressure, you know, if it's too high, it's dangerous, stroke, heart attack. But if you're talking about the low blood pressure, then you're worrying about if the blood is low, then of course body will try to preserve enough flow to the lady as well as the placenta. So one will have to give. If it comes to the point where the blood pressure is that low, of course the lady's system might override the fetal system, which will then mean there is a risk of not enough blood flow to the placenta, which can then lead to harm or even death to the baby. Yes.
Wow.
Or equally, if that hormone balance is not achieved and the blood pressure is, or it drops suddenly,
Yeah.
the lady then risks collapsing. And you
Wow.
can collapse depending on the environment where you're collapsing.
Which
Imagine if you're cooking, falling into
something
fire and there is nobody there to assist. So it can lead to,
something more serious.
yes, it can lead to something more serious.
Wow. And this one, the person asked, what is the relationship between cholesterol level and blood pressure? He said that I have a case of someone being treated of high cholesterol and the BP became normal. So what is the link?
Okay. We know that there is a lot of components within the blood. We have our blood cells transporting nutrients. We have our blood cells transporting oxygen. So, and all we eat, the food, is absorbed within the blood to then distribute all over. So imagine if you're eating high-fat processed food, then that means you have a lot of fatty content within the blood. And what happens? The blood then becomes very thick, which means the heart will have to work doubly fast, doubly hard to push along that very sluggish blood. And of course, if the blood is that sluggish, then it's more likely to clot. You're more likely to get deposits within the arteries, which will lead to blockage, which will then lead to the stroke or the heart attack that we're talking about. So by then, treating the high cholesterol means that you reduce the work that the heart will have to do, which then reduces the blood pressure.
Wow.
In simple terms.
Wow. Wow. Very amazing. There are a lot of things we need to know about our health. Little things. Wow, that's really amazing. And Dr. Osula, you would talk us through on this particular question that the audience asked, or the person asked. He said that I learned that blood pressure medications are meant to be lifelong. What can you say about a patient that has been on the medications for about 5 years, but recently experiencing lower blood pressure, reading of about 80/50? Her doctor has asked her to stop the blood pressure medication. How do you manage such situation?
In the main, the thinking is that it's lifelong, and most times it is. But calling it lifelong does not mean you will not be checked out in between. Because you should have your regular checks. And it's during those regular checks, if the blood pressure is still high, despite what you're taking, then you need an add-on treatment to it.
Okay.
If the blood pressure is stable, then you keep the person there. Like the case you referenced, if the blood pressure is low, I would have gone with reduction and monitoring. I'm not saying that what was done was wrong, because you don't know which way things are going to go. So rather than suddenly saying stop overnight, let's say the person was on 2 types of antihypertensives or whatever, I'll reduce it and keep on the review and reduce if need be. Because there's a risk of, if you stop suddenly, the ground you've gained, you're going to lose it and it shoots back up. So yes, essentially the whole thing is, once you start on treatment, you need regular reviews. Because there's a need to add, or there might be a need to stay there. And the third there might be a need. It rarely happens that way. You're finding yourself adding on rather than stopping. Maybe by the time you're getting as old as we are, or slightly older, then there might be a need to reduce it. But when you're kind of in that 40s and 50s and a little bit on the big side, you'll find that you're adding on rather than stopping.
Oh my God. So at the range of 80/50 with a patient that has high blood pressure, you're saying that that is that particular patient, rather than stopping it, you have to reduce.
We don't have the full history.
Yeah, depends on.
So she's just said something.
Okay.
So the history of this patient we don't have, and it's difficult to make a comment on a singular blood pressure because it's not leading you anywhere. But really, what happens in monitoring blood pressure? There are 3 arms to it. Just don't sit on it now.
Okay.
No. You should get regular checks. Because during those regular checks, that's when the determination occurs. Are you okay where you are? Then that's fine, you sit there. Is your blood pressure still high? One thing doctors should learn as well is you don't stop where you are, you add on.
Okay.
Because there's a clear guidelines on how you do what you do with the BP treatment. Start with A, and if A is not keeping things in check, you maximize that dose of A.
Okay.
And if on the maximum dose of A it's not working, then you add B.
Okay.
And then that's how you tailor it. You must have regular checks. And it's during those regular checks that will help you determine what to do. And it's either stay there, escalate, slowly de-escalate, or get them off treatment. So this particular case, I believe there will be other things in that story that we don't have. So it's difficult to comment on that.
It's difficult because you have to think about what else is happening in that person's life at that same time. Are they unwell with an infection, for example? Have they, maybe if they've been on that treatment for that many years, were they big and now they've lost weight? In that case, you need to tailor their treatment. So there is a lot to think about. It's not just simple, stop it. You have got to consider what else is going on.
Wow. Wow, have we heard it that if you are taking medication, you need to be, going to your doctor for review so that it will not cause any serious, it's not enough to say, oh, I'm taking medication, then I don't need to see my doctor. You are taking your medication, you need to visit your doctor for review. Good to know. Wow, that's amazing and wonderful. So another person asked, is pineapple and milk good for ulcer?
How can you go from pineapple to milk? It's totally different. Your milk is there. Your pineapple is there, acid. Milk, yes. Pineapple is probably cause you more indigestion and heartburn because it's too acidic.
Oh,
But milk, yes.
milk is good for ulcer.
Yeah,
So
milk
pineapple. So milk is good for ulcer. Pineapple is not good because it contains more it's acidic. So I've learned something now. Pineapple. So sometimes.
So something like orange juice, pineapple, they're in the same group. It will be too acidic. If you have ulcer, you're more likely to have more indigestion. But milk is soothing. Milk, yogurt, yes.
So it's a line of
Alkaline, yes.
I'm learning to be a little bit. No. So, some funny questions.
Well, it's good to ask if you don't ask.
So this one said, also, what are other contributory factors that cause the crashing of the blood pressure? Does treatment of other ailments interfere with the blood pressure medication? Yeah.
So like we talked already, you start the treatment, that's not it. You have to have your regular review. So say for example, a person started diagnosed with high blood pressure in their 40s and needed say 3-4 different medications. As they get older, in 70-80, of course you would expect they may not need that much medication, or equally the person was obese and they've managed to lose quite significant amount of weight, then it's likely that they wouldn't need all 3 or 4 medications. So you've got to adjust. Yes, some treatment, for example, will then lead as a side effect, lead to mainly either high blood pressure. Say, for example, people on steroid medication more likely to develop high blood pressure as an effect of the steroid. And where some other medication more likely to lead to low blood pressure as a side effect of the medication. So that's where you do need that regular reviews to make sure that the treatment is still appropriate.
Regular, wow. So I think this person likes starchy food, like myself, because based on her question, so her question says, yes, carbohydrates and sugar are not good for the body. But hard that one needs some % of those in the body. So how do we get it without to take starchy food?
Get % of carbohydrates.
Carbohydrate.
No, you need carbohydrates.
Yes.
For not excessive amounts of carbohydrate. I mean, what you class as your healthy plate is the carbohydrates, your protein from meat, your milk that you just talked about, your eggs, your fiber from your fruits and veg. So that's your healthy plate. And for your healthy plate, you need every little bit of everything. So even if you have, for instance, you have good going diabetes, you should have the carbohydrate. Because you hear people back home who are not supposed to eat garlic because no. You have a little bit of everything.
Oh, so that one will be discussing in our diabetic. Wow, that's good. I think we've finished answering the questions people sent to us.